Yes, 101.1 FM and AM 1160. And our conversation with Dr. Brian Walkowski. You have a brother named Steve by any chance?
Not that I know.
Okay. Brian Walkowski, brought to you by Marcus and Mack, a law firm representing injured people. Your bad brother Steve is not here. It's just you.
Just me today.
Just you. Hey, new to IRMC and a brand new entity or endeavor by IRMC, and you're right there at the forefront of it, the IRMC Weight Management and Bariatric Surgery Institute. Do I have that name correct?
Yes, you got it.
All right, wonderful. So let's talk a little bit about
Sure.
the hopes and dreams for you here in IRMC and for the new entity here. It is certainly obesity is a great problem
hmm
here, and it seems everywhere. And folks sometimes find themselves trapped in some sort of conundrum. How do I get out of this? How do I start off new in life? And you're here to help them.
Yeah, absolutely. First, thanks for having me on the show. Yes, as you alluded to, obesity is a major problem not only here locally, but nationwide and also developing around the world. There was a recent article that children growing up in this generation actually have a lower life expectancy than their parents, and that's largely in part due to obesity and all the diseases associated with it. As far as our Weight Management Institute, Indiana already had most of the services available. And what we wanted to do was just make all those services available under one banner, under one roof, that PCPs and other people in the community would just be able to refer their patients to and go to with just a single referral. And we had largely already all of the services with psychology, psychiatry, dietary, and we already had a medical bariatrician, but the one service we didn't have was bariatric surgery. And now with me coming on board, we'll be able to offer that service here in the community as opposed to having to ship those patients elsewhere.
Explain what bariatric surgery is.
So bariatric surgery is also known as weight management surgery. There's historically been lots of different procedures that have been done, but largely today the two procedures being done are sleeve gastrectomies and gastric bypasses. And those will be the two different surgeries that we'll be offering at Indiana.
Well, when we think about that, there might be people who say to themselves, that's my only chance. But it takes a few steps before you get to the part where you say bariatric surgery is your best option. Is that not correct?
Yeah, absolutely. And we like to see people experiment and try different medical weight management techniques. We like to have them supervised by a dietitian and the medical bariatrician first before going down the route of surgery. We like to have them supervised at least 6 months or so to know that they're going to have what it takes to be successful in the program. And we don't want to have patients undergo surgery unless we know they're going to be a success. And I always like to tell patients that we're going to put you in the best position to be successful, and we have a lot of different services at our disposal, and we make them available to all the patients.
So bariatric surgery requires a real commitment from the patient in order just to be eligible, does it not?
Yeah, absolutely. So the patients have to go through rigorous screenings, not only by their primary care doctor and our medical bariatrician, but also by the dietitian who gives them lots of tools that they can use. Also our psychologist, to make sure that they're in the best possible position for bariatric surgery, because it's not only just a surgery, but it's a total lifestyle change that you have to adopt after the surgery.
But all that being the case, so what are the benefits then of going through bariatric surgery?
Oh, they're myriad. So a lot of people like to think about the weight loss, but that's almost secondary compared to some of the other health benefits. So not only is it the weight loss and improved quality of life, but it's also reduction in their weight-associated comorbidities. So often patients have improvement in their sleep apnea, diabetes, hypertension, certain endocrine conditions, also reduction in cancer, as a lot of literature is suggesting. So pretty much every body system that you can think of will benefit from weight loss.
Wow, it's pretty amazing. It really is, to see what bariatric surgery might do for somebody. And let's face it, a lot of people, when they get to the point where they say bariatric surgery, I need to explore that, it's after they've tried so many other things.
Right. In some cases, it's almost a last resort that weight management in the medical sense with medication, diet, and exercise will only go so far. And a lot of the literature has shown us that surgery can be more effective in most cases with most patients.
So IRMC has this new entity. It's the Weight Management and Bariatric Surgery Institute.
Yes.
And so we've been talking about bariatric surgery itself,
Mm-hmm.
and you've talked a little bit about what you must do leading up to it.
Mm-hmm.
It is a whole process, though, isn't it? There's the leading up to the bariatric surgery, there's the surgery itself, and then there's post-op, and then moving forward even further.
Yes, correct. So the patients follow us for about 6 months or so, and we get them in a place where they're going to be good surgical candidates, and we go ahead with the procedure. And whether they elect to have a sleeve gastrectomy or Roux-en-Y gastric bypass, we continue to follow those patients over time. So it's not just simply a matter of doing the procedure and leaving them to their own devices. We continue to follow them for the rest of their lives, or as long as they're here in the community, because we want to make sure that they're adequately supported, as patients need to be followed very, very closely. So once you become part of the weight management family as a patient, we continue to follow you over time and make sure that you have everything in place to be a success and continue to keep the weight off, to make sure that they don't run into any nutritional issues, and any aspect of care that they would need, we would be able to provide.
So I'm sure you've been doing this for a while, and I'm sure as well that you know those success stories and how good they make that patient feel. What are some of the reactions people have, even a year or two down the road, to having had bariatric surgery and this big lifestyle change?
Sure. So it's one of the most rewarding aspects of the job, and one of the reasons that I chose to go into bariatric surgery is you get to have continuity with these patients that you wouldn't necessarily get in other fields of surgery. So you get to see these patients, and often they lose a lot of the weight within the first few months or so, and they continue to lose for a good year and a half, 2 years. And then their weight stabilizes, but in that time you see a transformation in that patient to where they're able to do activities that they maybe have never been able to do, whether that's going on a bike ride or even just playing with children or grandkids that their weight has precluded them from doing so in the past. And they come in and they tell you that they're off certain medications, or that their dosages have gone way down. It's just very rewarding that these patients have had their life back.
Yeah, absolutely. I'm sure their family members go, "Oh, here they come again. I'm going to hear about the bariatric surgery."
Sure.
But that's a good thing.
Absolutely.
Yeah. You offer other types of surgeries as well.
I do. So in addition to being a bariatric surgeon, I'm also a general surgeon. So I was fortunate enough to train at Conemaugh Memorial. I did my surgical residency there, and then did some additional training in minimally invasive techniques with the robot and advanced laparoscopy at Brown. And I was fortunate enough to be offered a position here at Indiana. So I'll be offering bariatric surgery, and in addition to that, general surgery. So everything you can think of as far as bread and butter general surgery, hernia, gallbladders, appendix operations. So anything that you could think of, I would be happy to provide in addition to bariatric services.
Dr. Brian Walkowski is our guest here this morning on Indiana in the Morning. You actually did a rotation here at IRMC, didn't you?
I did, back in 2018, yeah. Dr. Clark, I had worked with as a resident at Latrobe area, and he was doing a lot of advanced surgery. And I knew that that's something that I wanted additional training in, so I contacted IRMC, and I was lucky enough to get in to do a rotation there back in October of 2018, so almost 3 years ago now. And I loved the hospital. I loved the community. I loved everybody working there was very kind, very friendly. And I knew the type of environment that I wanted to be practicing in, so that laid the groundwork.
Originally from Scranton?
Yes, sir.
That's a little bit bigger than Indiana.
A little bit, but I think very similar areas. Both have the small town feel, and I didn't really grow up in Scranton so much as just the suburbs just north of it. So this is an area that's very familiar to me, having just trained 20, 30 miles away. And I'm a small town guy at heart, so this is the perfect setup for me.
Yeah, and even in this small town setting, you come to IRMC and you find out that's a big city operation over there, isn't it?
It is. It definitely is. Yeah.
The technology is just amazing.
It's amazing. They're doing a lot of advanced procedures there that you typically only see at bigger academic centers. So they certainly have big city capabilities for a smaller town.
Absolutely. All right. He is Dr. Brian Walkowski joining us here this morning. For folks who want to know where the Weight Management and Bariatric Surgery Institute is, and how to hook up with you or the institute itself? What do they need to do?
Sure. So we are located at the IASA building in Suite 2300 at the hospital. You can call 724-349-3170 to request an appointment. And of course, you can always look for additional information at irmc.org.
Yeah, it's quite the team in the surgery unit there, isn't it?
It is a bunch of all-stars.
Yeah, that's a good way to put it.
Uh-huh.
I mean, Dr. Clark and everybody else within that unit, and the nursing staff, the ER staff, the support personnel in surgery at IRMC. It's just an amazing group.
Yeah, that's great. It's you've heard the expression "it takes a village," and that's true of surgery also. So it's not only the surgeons, but everybody who helps them, and ultimately the patients be a success.
Yeah, it sounds like the Weight Management and Bariatric Surgery Institute is a real team concept too.
Yes, sir.
Dr. Brian Walkowski joining us here this morning on Indiana in the Morning. All right, last thing. You are an Eastern PA boy, and here you are in Western PA. I'm assuming,
yes,
with the Scranton connection, that you like the Penguins because you've got the baby pens there.
The baby pens, yes, sir.
Yeah. So the Pens are starting up this weekend. You're good with that?
I'm good with that.
Terrific stuff. Thanks for coming by, and thanks for allowing us to meet with you and talk with you about the Weight Management Institute and Bariatric Surgery Institute at IRMC.
Yes, thank you for having me.
Give that number again for folks that
Sure. So our contact number for the Weight Management Center is 724-349-3170.
There you go. Get it done, boys and girls. The Weight Management and Bariatric Surgery Institute at IRMC, just another tool as we fight obesity and the various different types of conditions that can result from it, and maybe get ourselves back on track. It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.